And I'm going to be speaking today about the kind of stories we tell about service design and how that is kind of being shaped and currently in progress. And it's based on my PhD work that I've been doing for the last 4 years in Sweden called Invisible. So to put things in context, about 8 or 9 years ago, I was working at the Mayo Clinic Center for Innovation, and we got assigned a project that was related to patients with burning mouth syndrome. I'm not sure if you know about this disease, but it mostly affects middle-aged women, and they feel like their mouths are on fire constantly. So typically, they would go kind of throughout the United States to their primary care doctors and let them know how they were feeling, and either get dismissed or ignored or told that it was all in their head. And then eventually, they'd stumble to Mayo Clinic, where they'd visit a dermatologist and get a diagnosis. But unfortunately, there wasn't much that the clinic could actually do for these patients. So they would refer to a pain management specialist, but there was nothing more done. So when we started to observe and kind of map out the patient journey of these patients, we started to see that in their kind of way of life and how they were dealing with their condition, there were things that could benefit different patients being shared between them. So we started to kind of carefully craft all of the touch points and the interfaces for a new type of medical visit for these patients. It was a group medical model where 5 to 6 patients would come into the clinic at the same time, and they would have a 2-day visit facilitated by a pain management specialist with a short visit with a dermatologist. And there they would kind of share tips and tricks. So we had 2 prototypes of this visit, and we did kind of some evaluation of how it went. And all of the patients that participated in the prototype said that they preferred the group medical model over the individual one. And actually, to our surprise, many of these patients told us that their pain was reduced by meeting people with the same condition. So we were flabbergasted with the results. And then after the kind of prototyping process, the design team and the clinical team were sitting around a boardroom table and discussing things, and everyone was very excited with how things had went. And then just as the kind of meeting was about to end, the head dermatologist said, "Yeah, but I feel more disconnected from my patients this way." And actually, if we were honest with ourselves, there were issues with billing too. There wasn't the right billing system in place for the group medical model. And it was quite hard to actually fit in these 2-day visits into the regular kind of appointment flows. So there's all of these factors that we hadn't really considered. So everyone agreed, though, that despite these things, we would try and kind of implement this over the long term. It made a lot of sense. But slowly, over time, as Chris mentioned, this group medical model was eroded because it didn't fit in with the regular ways of working. I see one of the key problems with service design in the way that I have practiced it is a narrow focus on the design of services, specifically attention to the physical touch points and interfaces that doesn't account for the invisible systemic relationships and interdependencies that need to be transformed to realize long-term change. I'm by far not the only person to realize this problem, and within the academic space that I've been dipping my toe into, there's been a host of other scholars and designers who have been doing research on different ways of thinking about service design. So we are slowly kind of moving from this focus on design of services with a narrow scope to a more kind of fluid model of design for service, recognizing that all we can do is create the context and create platforms for people to interact and serve each other. And I would like to propose a continual kind of shift and build on some of this ongoing conversation that we're calling service ecosystem design. And I'm going to tell you a little bit about that through lessons learned from the last 4 years that I've been kind of embedded within Experio Lab in Sweden. Experio Lab is a growing movement of service designers and healthcare professionals and patients and caregivers who are embedded across more than 8 different regions within the Swedish healthcare system. We have a number of them here today. Thomas is here, and I've lost track of where the other Experio Lab gang is. Track them down after this session today. They're doing incredible, incredible work. So I'm going to share some of the lessons I've learned from what they're up to. In particular, I want to highlight some underlying assumptions that I had going in about service design that have slowly transformed through my understanding of their work. First, I understood primarily that the value of design was in its output, something maybe adopted from a product design mindset or mentality. And even within this work, it's sometimes regarded that those are the most important things. So in one of Experio Lab's projects called First Line, they worked with youth who have minor mental health issues and trying to get them to access care sooner and in a way that makes sense for them, and developed an app and website to help youth monitor their own mental health and to help them connect with counselors. And often when people talk about design, what's pointed to is this is what design has done. This is the outcome. Here you can see it. But actually, from really digging into that project, I would argue that the value of design is in its process. And we can't forget that. And when Kat Drew talked at the Members' Day last night about impact, I think that's not just about outputs, but also about process. And we have to get real in how we're talking about the impact of our process within design. So when I looked at the First Linea project, or First Line in English, I started to interview people and understand that it was the changes that were happening through this participatory service design process that was making space for new possibilities. So one of the counselors that was participating in these prototyping sessions started to change how she was thinking about the youth involved, seeing youth from someone that was in crisis that needed help and support to someone that was resourceful and could kind of guide their own direction. Even from kind of engaging with the youth in this different way, this counselor said she started to pick up the phone differently when youth actually connected and asking less questions and letting them direct the conversation in different ways. This can happen by the spaces that we create in the design process, and I think it's this process that we need to really craft and celebrate. Another of these underlying assumptions is that design is an activity done by a few. Now, of course, there's kind of growing discourse and dialogue about co-design within the space right now. And so we're saying it's not just designers who are doing design. We invite other people into workshops, and we celebrate that, and they can come and design with us. But I would argue from looking at my research in Experio Lab that it is not just those spaces, these kind of invitational activities of design where design is happening. It is much broader than that. And that, in fact, design is a fundamental aspect of all social life. So when I did observations in the Karlstad Hospital, I shadowed a doctor who was moving through the infection ward of the hospital. And as he started his day, I noticed that he, instead of just taking the printout from the electronic health record for all his patients that he was about to go and do rounds to, he actually carefully kind of plopped the inputs from the electronic health record into an Excel spreadsheet so that he could have the printout look differently for him. I asked him why he was doing this, and he said, because I know that how this information is structures how I have this conversation with my patients. So I want to make sure I'm prioritizing the right things. I think that is ongoing designing of services and what we're doing. And I think we need to acknowledge much more than we do. And I think it's a colonial gaze in the way that Jesse Wente was talking about that's preventing us from not accepting design as a kind of larger sphere. The next kind of underlying assumption that's been challenged through Experio Lab's work is the notion that design is a cognitive process. And perhaps that's been shaped by some of the discussion here on Turtle Island about design thinking, and we think, that design is about reframing and changing our way of thinking about something. And we structure some things in this way, trying to generate ideas with post-it notes and things like that. But the team at Experio Lab have showed me and made me feel firsthand that design is actually an embodied experience, that we have heads in bodies with senses, and that is what is helping support this transformation and the reframing process. So one of Experio Lab's first projects was called the Patient Journey Project. And in it, over the course of a 12-week period, every Friday, 30 staff from throughout the hospital gathered together to do role-playing of the patient journey. And they moved through kind of stretchers and videotaped their experience, then reflected on it, mapped it out, and started to kind of unpack it in different ways. And when you ask some of the participants who have been a part of that process what happened, they'll tell you that it was actually the visceral feeling of being on the stretcher and being in that place that shifted their ways of thinking. So one of the nurses, Ulla, was kind of on that stretcher, seeing the lights pass by overhead, and just had this feeling, actually, maybe the care that I'm giving isn't as person-centered as I was thinking it was, and as we were talking about it. She felt the notion of being out of control and not having kind of the services in the way that she wanted in those footsteps. But it wasn't something she kind of thought up while sitting around a kind of boardroom table with Post-it notes. It was something that she viscerally felt. The next and fourth underlying assumption that's been challenged is this idea that social structures are kind of out there. They're an externality of the design process that we really can't deal with as designers and as people working within service design. But one of the Experio Lab projects called Chronically Engaged that was looking at how to improve the experience for people with chronic disease in primary care, slowly the team, over the course of the project, started waking up to some of the underlying roles and norms within the clinic that were actually getting in the way of that care. So when they went out into patient homes to do interviews, they started to realize, the patients' homes were much like their homes and the homes of their friends. And they started to relate in a different way, seeing patients as partners, and think differently about how they were practicing. And these roles and norms, those are the very social structures that are being reshaped. So actually, I would argue that social structures are the materials of design. So when we think we're prototyping, like in this project, a new kind of brochure to on-ramp patients into an appointment that gives them a voice, actually, we're prototyping and shaping the roles and the norms and patients' ability to speak and how much autonomy they have and our structures around doing that. And that is how we kind of get long-term change. The other big learning that I've had is that there's this underlying assumption that we have often in how we're conducting things within our service systems, that we're somehow separate from the systems that we're designing, that we can kind of point to a map on a wall. So in one Experio Lab project called the Test Tube Project, it started with people calling in one of the design leads and saying, we have a problem. We have a lot of errors in blood and tissue sampling happening within the hospital. And everybody was pointing to everyone else saying, the lab was saying it's the frontline staff's fault, they're not doing it right. The frontline staff then said, we just get these memos back from the lab saying we're not doing it right. And everybody was kind of pointing to someone else. But actually, in fact, we need to kind of wake up to this idea that we as people are fundamentally entangled and part of the systems that we are designing. So as the team went through this process, they started kind of developing together a checklist for how the blood and tissue sampling process could work. They were sharing with each other strategies around doing that, what were the most effective ways. And in doing this, it wasn't actually some out there checklist. They realized what they were redesigning is their own systems and their own ways of working and being. The last fundamental assumption that I'll highlight, which has been kind of growing in some of the discourse in service design recently, is this underlying assumption that design is politically neutral, or even inherently positive in the work that we're doing. So we see we're advocating for service users, and that makes it inherently good. One of the recent projects that Experio Lab has done is called Respectful Meetings, and in it, they were determined to kind of make this exhibit in one of the hospitals that was exploring respectful meetings. They made two virtual reality scenarios that people could experience. One that was based on a kind of standard treatment model, the other that was based on a kind of personalized, person-centered model, and we're wanting to get people to kind of reflect with this idea. They built a paper mache heart and made a beautiful exhibit. And 1 week before the exhibit was about to get set up, they received an email from one of the primary care doctors saying, "What credentials do you have to be able to kind of tell us how to deliver services?" And then soon, one of the leaders at the hospital halted and said, "You can't carry out this exhibit," because, with actually not giving a reason at first. And you can see in this process that actually design is inherently political, and every project and process that we do, because social structures are kind of fundamental to doing it, it is absolutely political, and that social structures are dividing power across power lines. So while after some very tough negotiations and advocating, the exhibit did kind of come to be within the hospital, there was still lots of dialogue within some of the staff that came forward and said, "You're highlighting the patient experience, but that's biasing things away from the much needed service provider experience as well." And so you can see that there's a lot of negotiating and a lot of stakeholders with different power positions that come into play in the work. So just to highlight kind of some of these shifts and assumptions, through this kind of research, I have moved from thinking about the product to really focusing on the process, from thinking about the designer to everyone, from cognitive to embodied, from thinking about social structures as externalities to materialities, from thinking about the system as something out there to thinking about ourselves, and from assuming neutrality to assuming that things are political. So, in fact, what I'm coming to wake up to is this idea that service design is actually this ongoing process of shaping social structures. And this is what I was seeing in the work within the Swedish healthcare system. So social structures, as these kind of materials, they're not so abstract, actually. You can see kind of on the top of the iceberg here that there are physical enactments of social structures. The touch points, the interfaces, these things are kind of manifestations and representations of social structures. So symbols and artifacts and the activities and how we interact, these are all part of social structures. But then we also have this kind of invisible elements of social structures that have different pillars. So we have a regulative pillar that are the kind of laws and rules. We have a normative pillar that are more about our informal norms and roles. And then we have some of the entrenched kind of beliefs and frames. And these kind of things that are below the surface are very taken for granted and shared. So it's very hard to actually unpack them to make that long-term change. But I would argue that when we think about social structures as our main design materials, that we need a different kind of process model. And so Kat Drew is going to be digging in with folks later on the kind of evolving the double diamond, and I'm going to put out some things that I think could continue to support the ongoing evolution of some of the conversation around our design process. I would argue that in kind of doing service design, we're actually in a much more kind of feedback loop, a double feedback loop. And we're not kind of thinking outside the box. We're actually entrenched in processes of non-design. We are constantly reproducing things that just make sense for us based on our entrenched ways of working. And then that reinforces that behavior for ourselves and others, and caught in this loop. And when we do design, I would argue it's when we're intentional about how we're shaping these social structures. So it's a process of building reflexivity, this awareness of the social structures, and then intentionally reforming them. And I'll tell you what I mean by that. So fundamentally for me, I see service ecosystem design as this process of making the invisible visible, bringing forward these underlying kind of regulative, normative pillars and making them visible, and then using the visible elements of our service systems to actually transform these invisible elements of social structures. And that, I think, is the design work. So when we look at this kind of project example of the patient journey, we can see that actually by being in the stretcher, that helped make things visible that weren't visible before about the roles and norms around care for this nurse. And then when she went out into her everyday work, she started doing things differently, asking patients if they wanted tea before sitting down, telling patients where the washrooms are. And that is the design process, this kind of reshaping the norms within the space. But she was also caught in these non-design feedback loops that other people were reinforcing certain behavior and actually ended up quitting her job to go onto another team that felt more supportive. We're not outside of these systems that we're trying to redesign. So in the research that myself and some of my colleagues have been doing, we're seeing kind of 3 fundamental ways in which we need to build awareness of social structures. So this happens by just kind of revealing these social structures, these norms, making these kind of things unhidden. Also by kind of noticing structural conflict. So the diversity that Jesse Wente was talking about actually helps us see some of these things in different ways and see that there's multiple of these things that are conflicting. And importantly for being able to shape and change them is to recognize that we can shape and change them, that they are malleable and that they do evolve over time. So we have to appreciate that. And the process of reformation, which is kind of changing these social structures, is made up of 3 fundamental processes as well. There's a process of creating new social structures. What are new roles that we can put forward in the hospital, of a new coordinator, or new norms that we can enact together? But in order to do that, we also need to disrupt some of the existing social structures that are currently in place. But fundamental to this work, which was a bit of a kind of surprise in going about this, is actually a lot of maintenance work. So in order to build legitimacy for the kind of changes that you need to make, and in order to sustain our systems over the long term, a lot of design work is actually maintaining some of the existing social structures and doing that intentionally. And I would like to highlight that this sort of view of service ecosystem design is not just at this kind of large scale. It's also very much an individual process, and a process of kind of designing our systemic selves while then designing within collectives in these multi-directional, conflictual design processes that are existing in our society with overlapping service systems. So in this kind of first line project, when the counselor started picking up the phone differently, that's redesigning her systemic self, which is part of this larger service ecosystem design of how these youth are experiencing care and how to go about redesigning services. So just to kind of highlight and leave you with a few practice ideas that I've been experimenting with, I'd like to highlight a few design principles that I've been working with. I don't think they're done or perfect, but things that I've been exploring about how to do service ecosystem design. The first is kind of focusing on these underlying patterns. And how do we get there? One of the things that I've been playing with is this approach of story unwriting. So this idea that it's very hard to actually unpack our existing social structures just by reflecting ourselves. But sometimes when we hear a story about our work and our way of doing things, it's easier to unpack that together. So we've been taking stories and kind of pulling them apart and asking ourselves, what are the underlying kind of norms and rules and roles that are contributing to this kind of story? And that can help us make some of these things easier to work with. Another way that we've been doing this, that I've done with one of the former Experio Lab designers, Felicia Nilsson, is what we're calling social structure archaeology. So when we went into the infection ward, we did a lot of observations about what are these kind of physical aspects within the clinic and how are they upholding some of these invisible social structures. So you'll see there the kind of big red chair. We saw the doctor really debate where to sit. Oh, do I sit on the red chair? Then I'm not aligned with the view of the patient. Oh, and then grab the patient's walker and can sit and level the playing field. So these physical structures are part of how we're enacting our systems. You can see the big hand pump in the back because there's so much work that's being done to maintain this norm of hand washing that's happening within the hospital. The other kind of principle is this idea, which I mentioned, of making the invisible visible. And I think this is a really important way that design can contribute to the system changes that we're seeking. So one example of this from Felicia's work that she did with Experio Lab is the idea of the double stethoscope. And so I call this kind of like recrafting artifacts. So she didn't design a double stethoscope to become kind of used across all of Sweden, but she was working with a primary care team to explore some of the invisible social structures that were playing out in patient appointments. And she built this double stethoscope for people to play with, and they built them as well. And as they played with them, they started to see, oh, I need to sit at the same level as the patient when we're doing this. The patient started asking questions about what they were hearing and having a different dialogue. So sometimes by kind of using artifacts, we can start to bring and make visual some of these underlying things that we generally take for granted. Another kind of principle is the idea of focusing on changing the rules of the game, getting at these underlying social structures. So some of the things that we've been playing with are something that we're calling fishbowl improv. So the idea that some people are kind of role-playing or improvising a certain scenario while other people are watching. And as they do that, the audience is calling out, what are the underlying rules of the game in this scenario? So in a patient-doctor visit. And then the audience gets to redefine those rules of the game, and people have to try and act out with those different rules that are defined as a way to understand that we can shape and the possibility of kind of changing some of these underlying rules. Another principle is this kind of fundamental idea. If design is a fundamental aspect of all social life, then we really have a responsibility to nurture the designer and everyone and highlight their agency. So I've been toying with this approach of a tiny test, which is just the idea that people take some aspect of their lives and test out how they might shape social structures within that. So this is the example of a doctor who agreed to test out wearing their plain clothes to work to explore the kind of professional status and how that adjusted things. So tiny tests are not to say individuals are responsible for overall systems, but to really actually appreciate our own roles within them and recognize the resistance that we face, how we might shape things, and our own role in kind of carrying these out. The second last kind of design principle is this notion of seeing yourself in the system. One of the kind of approaches that I've been toying with some colleagues is the idea of a kind of day in your life. So just the typical kind of mapping your own day and what that looks like, and then sitting around a table with a diverse group, actually having other people highlight and call out what are the underlying social structures that you're playing out in your life as a way to help you unpack your own role and your own systemic self, because we're blinded and take a lot of these things for granted. The last principle is creating the context for emergence. We can't have full control over the work that we're doing in service systems, but we can create the context for value. So the iceberg framework is something that we've been working with, which helps people kind of map out what are the experiential elements of a service system that people are focusing on, what are the invisible kind of elements that we often take for granted, and then together, can we decide what we want to prioritize to create, disrupt, and maintain to actually make these changes a reality? And we've been engaging people in this to test it out in different ways. It's not a finished method or prescription or approach. We're just toying with it. So lastly, I'd like to leave you with a kind of metaphor from a story from my childhood. My mother is an avid gardener, and I used to help her out quite a lot as a child in the garden. And as many of you may be, in my helpfulness wasn't always helpful. I definitely started my weeding process by just kind of snapping off the tops of the dandelions. Much to my surprise, but not to my mother's, the dandelions quickly grew back in full form. And my mother reminded me that actually, if you want to remove these dandelions, you have to pull them out by their roots. And I think that sort of a lesson is a lesson that we need in service design today, to pay attention to the roots of the things that we're working with, the entangled, invisible social structures and elements within the physical enactments and spaces that we're working with. So I'll leave you with my kind of favorite all-time quote from the book Zen and the Art of Motorcycle Maintenance. If a factory is torn down, but the rationality which produced it is left standing, then that rationality will simply produce another factory. If a revolution destroys a systematic government, but the systematic patterns of thought that produce that government are left intact, then those patterns will repeat themselves in the succeeding government. There's so much talk about the system and so little understanding. And I think that's the case in service design right now. We're talking a lot about the system, and we need to do a lot more to become system literate. Thank you very much.